So we're going to start taking a look at the muscles of the cranium. First, I downloaded or I printed off this outline that I gave you. So right here where the X is, or the bullseye or whatever, right frontalis muscle, temporalis, occipitalis. Okay? Frontal over the frontal bone, frontalis over the frontal bone, temporalis over the temporal bone, and occipitalis over the occipital bone. Now some people call this whole complex around the cranium the frontal occipitalis. But they're connected, those two muscles are connected by the galea. Those two muscles are connected by the galea aponeurotica, galea meaning helmet, and it's also called the epicranial aponeurosis. I'm not sure what your book has, but this program gives both names actually. So those are the muscles of the cranium. Then we go to the muscles of the face. Looking straight on, two round muscles, orbicularis oculi, the orbit of the eye, and orbicularis oris, the round muscle that makes up the lips. That's also called the prayer muscle. Not the prayer muscle, it's called the trumpet muscle, because you can, or the kissing muscle, because you can purse your lips. If you look at a large version of this, you'll find that there's 4 muscles there that are connected. One goes this way, the top goes this way, the bottom goes this way. They're connected to other muscles right here in the corner of the mouth, which are connected to the zygomatic bone. And those muscles act like a scissors, okay? Now, coming back from the corners of the mouth across the cheek towards the lower ear is the Buccinator or Buccinator. You know, if you've been to the dentist, they talk about the buccal surface of the teeth, which is the cheek side, and they talk about the lingual surface, which is the tongue side. Well, this is the buccinator muscle or Buccinator muscle. It's also known as a trumpet muscle because it allows you to blow air, hold air under pressure and blow it through a trumpet. Okay, and then coming off of the zygomatic bone is the masseter muscle, which we call the nutcracker. It comes down and attaches from the zygomatic bone to the lower jaw. Okay, lower jaw. So those are facial muscles that you might find interesting. Now, we mentioned sternocleidomastoid, okay? The mastoid process of the temporal bone is where it inserts. It crosses the clavicle, which is the clavicle, the collarbone, and it inserts in the sternum. It's also called the prairie muscle because that muscle allows you to bow your head. It pulls your head down. You ought to see it in a giraffe. It's humongous. And a giraffe can't lower its head without that muscle. A giraffe's head wants to stay up all the time. Underneath the chin, connected to the top of the shoulder here, is the platysma. Okay, that's in the front. We'll skip the chest for now and we'll turn around and go to the back. Again, there's the deltoid muscle on the shoulder. You see that it's a triangle. Okay, looking at the back, there's a broad triangular muscle connected to the backbone by an aponeurosis. Is called the trapezius. I'm going to outline it for you. Now I'm going to dissect it. I'll get the dissect tool. Dissect. Bam. I took the trapezius off on the right side. so that we can see underneath what's underneath, and we can see the rotator cuff muscles. And to see them better, I'm going to remove the deltoid muscle. There we go. Now, see this little white bar here? That's the spine of the scapula. Below it is the infraspinatus muscle. That's one of the rotator cuffs. Above it, very hard. Above it is the supraspinatus muscle. If I can get it to show up here. There it is, supraspinatus. Infraspinatus, that's 2 of the 4. This little band here that's underneath is the teres minor, and there's one more muscle that makes up the rotator cuff, and I'm going to take off the infraspinatus. I'm going to take off the scapula, and there is the subscapularis, the 4th muscle that attaches on the scapulas and inserts, or the origins on the scapula, and inserts on the humerus so that you can adduct and abduct or move your arm back and forth. And they all connect on different spots on the humerus. You can see the teres minor, it connects over here. And the subscapularis connects on the other side of the humerus, and so forth. Okay. Below the trapezius is a big, broad, flat muscle called the Latissimus Dorsi. Dorsi being the back. Again, a big, broad aponeurosis connecting it to the middle of the back or to the spine. That is flank steak, also known as flat iron steak. Used to be just flank steak, and then it was cheap. Now it's flat iron steak, coming from a cow, of course, and they charge you a lot more money for it. So those are the superficial muscles of the back. Let's take a look at a couple of other interesting ones. I'm going to take the Latissimus Dorsi off here, and you'll notice coming down along the spine is the longissimus muscle, and that is the eye of the rib eye. That's the rib eye muscle. Okay, and when we go to the front, we'll take a look at where the good stuff is. These are intercostal muscles here. You'll see those from the other side also. And looking at the butt, okay, the gluteus maximus is the big butt muscle that you sit on. It's a very strong muscle, and it is usually used in rump roast, right? Then above that, the gluteus medius is a muscle that is used for injections, like the deltoid. It's a safe place to stick a needle without hitting a major blood vessel or a nerve. You don't want to hit the sciatic nerve by going into your butt muscle, because that can really hurt. Okay? So, what about the gluteus medius? There's a third gluteus. The maximus, minimus. Gluteus minimus is right there underneath the gluteus maximus, and the gluteus maximus covers most of the medius and the gluteus minimus. Okay. Now, the upper part of the leg. There are 3 muscles on the back of the leg that make up what we know as the hamstrings. One is the biceps femoris. Biceps femoris, right there. I'm going to take it off. Semitendinosus is another one of the 3 hamstrings. And semimembranosus, just medial to it, is another one. So semitendinosus, semimembranosus, which is right under the biceps femoris. Remember, biceps, 2 heads, femoris on the femur, that corresponds to the biceps brachii. Just you flex your leg in the opposite direction that you flex your arm, and that allows you to walk and maintain balance. Below the hamstrings is the gastrocnemius, a two-headed large muscle that gives the shape of the calf in your leg, and is connected to the heel by the Achilles tendon. Okay, let's turn around. Before we turn around, Triceps Brachii on the back of the arm, deltoid again, Biceps Brachii on the front of the arm. They are muscles that work in unison. One's an antagonist, one's the primary mover, and it depends on which way you're moving as to who does what. Okay. Pectoralis Major, big muscle on the chest, under the mammary region. And if we dissect that off, you see the intercostals. Now below the intercostals, which you can't see in this view, is the diaphragm. We'll look at that in a minute. But the diaphragm, when the diaphragm contracts, the space inside the chest cavity gets larger. And these intercostals also contract, pulling the ribs apart and making the chest cavity again larger. That reduces the air pressure inside and air rushes in. So you don't really suck in air. Air rushes in because the muscles expand the size of the chest, reducing the pressure therein. It acts like a balloon. If you have a hole in this, pneumothorax, you cannot breathe because you cannot regulate the pressure. There's a hole to the outside. It needs to be closed. Let's look at the abdominal muscles. Right here, rectus abdominis, straight up and down, rectus abdominis. These are the muscles that give you the six-pack. Okay? Outside there, the external oblique. I'm going to take it off. Going the other direction, below the intercostals, is the internal oblique. Okay? And if I take that off, going directly across parallel to the ground is the transversus. External oblique, internal oblique, transversus, and then rectus abdominis. Those are the four muscles you need to know there. In the front of the leg, there are the quadriceps, the quads, four muscles. Rectus femoris, straight up and down on the femur, rectus femoris. To the left of that is vastus medialis, medial, on the medial side, and lateral side, vastus lateralis. There's also a vastus intermedius. Where is it? Right under the vastus femoris. Take it off with the dissecting tool. Vastus medialis. Let's see. Vastus intermedius. I had to move my cursor down here. And then inside, wrapped around from up here, and then wrapped around and across the knee joint down here is the sartorius. Okay, and inside on the lateral side, if I can find it, there's a gracilis here somewhere. There's a sartorius. We'll find it eventually. But the gracilis comes along the side too. Maybe it's on the outside. No? Anyway, turn that around. And on the bottom of the leg, we did say gastrocnemius, and I forgot to point out that on the inside is the soleus. The soleus is a little rubber bandy muscle that wraps around and crosses the knee joint and gives you some strength there across those joints. In fact, there are several muscles that cross these joints on the elbow and the knee that give strength to those joints. So that covers most of the superficial muscles that you need to know, and I recommend that you get the free version of the Biodigital Human, and you can play with this, and it'll help you to learn. Even though the diagrams in your book are good, I think this is a real help, okay, a real help. So, there we go. Muscles 2, names, nomenclature,